My name is Farah, and today I'm going to be giving medication to Miss Mary Edwards. So first thing I want to do is to review the doctor's orders, and it does say Mary Edwards with a date of birth of 2/2/40, and she is to receive bumetidine 0.5 milligrams IV push over 60 seconds. I'm going to look at her allergies, and she is allergic to penicillin. Her diagnosis, she has fluid overload and also hypertension, and that indicates why she's getting this medication. So what I would do after reviewing the doctor's orders is to wash my hands. And after washing my hands, I would go in and I would introduce myself to her, let her know that I'm here to give her medication. I would have her state her name and her date of birth, and then I would verify it by looking at her name tag. So I would do my 5 rights, right patient, right dose, right route, right documentation, and right time. So I've done that, and I've checked the doctor's order, and next I've washed my hands, and now I'm going to don my gloves. Okay, so after donning my gloves, then I'm going to just look at the order, which again says bumetidine and 0.5 milligrams, and according to calculations, she should be getting 2 ml IV push to be infused over 60 seconds. So I would get the vial and just make sure it does say bumetidine, and I want to check the expiration date, and it expires April 2027, so I know it's current. So I'm just going to remove the cap. Okay. And then I would get alcohol, and I'm just going to clean the top real good. Make sure. Okay, so I would clean it, circular motion, in and out. All right, so that's clean real well. And then I'm just going to get my 3 ml syringe. Okay. I'm just going to remove the safety device, and I would be using a 22 gauge needle. So to make sure it's locked in place, and then I'm also going to look at the medication again, where it does say bumetidine, and I would have told her that she's getting this medication because we want to pull fluid out because she have edema and also hypertension. So I would be, explaining that to her. So she's going to get 2 milligrams. So then I always like, whenever I'm pulling up meds, I just kind of put air. So I'm holding this to make sure. It's going to be 2 ml. So then I would just, like that, put air. Okay, so then I'm going to pull up 2 ml. Okay, so I've pulled up 2 ml, and now I don't need the needle anymore. So I'm just going to do the safety and then get rid of the needle in my readily accessible sharps container. And then what I'm going to do, because I have a clean surface, and I'll just put that right there, because we need to flush the IV with the 3 ml. So I'll get ready. So I get the saline, and then what I'm going to do is clean the port. And while I'm cleaning the port, I'm just going to assess the site, which is very important. I looked at it before, but I'm also looking at it again. There's no redness, there's no swelling, so there's no indication of any abnormality, no infiltration or phlebitis. And then I'm going to just clean the port real good. Going to make sure it's unclamped as well. Okay, all right, so I'm going to clean it real well, and then I'm going to do 3 ml flush of the normal saline. Okay, so it's patent, and then I'm just going to cap the saline, leave it here, and then I'm going to infuse the bumetidine, and I have the order right next to me. I've done my checks, but just before I infuse it, again, just verify that I'm giving bumetidine to Mary Edwards with a date of birth of 2/2/40 for fluid overload diagnosis and allergy to penicillin, and it's to be now, and it's an IV push. So now I'm just going to and I'm going to do this over 60 minutes, 60 seconds rather, a minute. So while I'm infusing slowly, this is the time that I would just talk to my patient, ask her how she's doing, how was her night, and about the weather, just any concerns that she may have. So that way it's not like an awkward silence, just infusing the med, but just, you know, slowly while talking to her, while I'm also checking the time as well. Some medication that should be infused slowly. And while I'm talking to her and infusing the medication slowly, I'm also looking at the site. And I did check to make sure that her IV dressing was, the date was current, and it is today's date, the 21st. So everything looks good. And just about a minute. Okay, and everything looks great. So then I would just remove it, put it in the sharps. It's not sharp because there's no needle. I could have put it in the garbage as well. And then I'm just going to do another flush, 3 ml. Okay, so I do the flush, it's tolerating everything well, and then I would just clamp the IV, ask her if she needs anything, and I would just clean everything, ask her if she needed anything, remove my gloves. And after removing my gloves, then I would clean my hands. And then I would put her in a comfortable position, give her the call light, and ask her if she's comfortable, if she wants to have the bed up. Make sure she has the call light, ask her if she needs anything. If not, then she's fine. And then I would just document that I did give her Bimetadine 2 ml, that's the 0.5 milligrams IV push, 2 ml, and say to her, see you later. Okay, thank you.